like to join me here at the table, and Alison, if you could come also. And John, are you still there? Can you hear us? John? Dr. Samet?
Oh, sorry, I was on mute. I'm here. Yeah, hi.
Very good. Perfect. So we are going to start with the questions, and we'll start with the members of the committee. And we would like to ask the members of the committee if they can go to the microphone over there and stand, because it was not working very well earlier. So they preferred if you can stand, please, and ask the questions by the microphone over there. Is that okay? If you don't mind.
So thank you very much for the good suggestions, Ray and Allison, of what we might ask of the FDA. Could you say more about what you're planning to do in the time frames? Because my understanding is that the publication that's just come out is kind of a top level, and then there's more that you're planning to do in specific areas. Could you say a little bit more about that and the time frame for that, so that we can learn from you what you've done and not need to replicate everything?
Absolutely. Yeah, like you said, the paper that was published was intended to be more of a kind of top-of-the-tree summary of all the different content areas that have been published related to ENDS. So we wanted to, drill down on those specific content areas for future papers. Currently, we have one that's under review, focusing on the literature on the relationship between ENDS use and smoking cessation. We also have one that is about to be submitted, focusing on marketing and communications related to ENDS. And we also have one that's kind of been underway for a long time, but we don't have a timeline for it, related to the health effects as well. That we presented some today, and then another one on patterns of use. So there's no timeline on that one either, but I would guess in the next year.
Yeah, this is all just resource driven. I mean, we could be working on dozens of papers, but there's only so many hours in a day and so forth.
So the one on cessation, I guess I should be standing for the one on cessation, that sounds like it's close to being potentially available. Is that?
Yes, that's true. We submitted it to a journal, and it has undergone peer review, but we are now updating it based on those additional studies that we pulled in February. So it's going to take a little time to go through and synthesize those and determine what additional studies we want to include.
So Tony Alberg, Medical University of South Carolina, and just a question on the systematic review itself. So number one, you didn't present any quantification, for example, of the pulmonary data or cardiovascular. Is that something you're planning to do and you couldn't present to us, or it's in progress? Just clarification.
Yes. So as I said before, we do plan to pursue a manuscript looking at the health effects of ENDS use, and we have started to create, based on our data extraction, tables that have all those study characteristics, including organizing it by outcome, so looking at pulmonary data, cardiovascular, et cetera. So we have some of that, but we don't have it formally synthesized to have that available for you at this point.
Okay, and then some of that information was presented fairly quickly, so I just wanted to make sure what the comparison group was. That was the methodologic point that you're highlighting, but the increase in cognition with e-cigarette use was compared to what?
That was a lab-based study. I can't remember the specific tools that they used to measure the improvement in cognition, but it was after I'm guessing like a 10-minute, 5 or 10-minute ad lib use of e-cigarettes, and then they measured that pre and post, basically.
And part of the issue with these studies, if you're studying smokers and they undergo some period of deprivation, what are you seeing? Are you seeing an improvement, or is it just a recovery to baseline as a function of, relief of withdrawal symptoms? And so there's all these issues that have to be teased apart in studies of that nature.
Right, because that's a well-known property of nicotine itself. So my guess is that's probably what you're seeing without seeing the evidence. And again, another just comparator issue. I believe you stated verbally that the pulmonary effect showed an improvement in pulmonary function with ENDS use, and again, just compared to what?
So that was among smokers who had switched from cigarettes to ENDS. So that was comparing them at the beginning of the study at baseline when they had not used ENDS yet, and then after when they had switched from cigarettes to ENDS use.
Thank you.
Right, and just related to that, we shouldn't conflate, those studies with studies, say acute administration studies, where there may be, in fact, some acute pulmonary effects that appear to be detrimental, and there are the studies like that too. So in terms of airflow and things like that. So.
Sure, and I think those studies just highlight the challenges facing the committee that you pointed out in the sense of smoking cessation, the reduction in combustible tobacco product use compared to nothing at all compared to the ENDS use. Thank you.
Ken Pinkerton from the University of California, Davis. This is actually a question for Jonathan Samet. John, I was very interested in this whole idea of risk assessment and what's the best way to do it. You presented IRIS versus IARC. I realized that IARC would be looking at the potential for carcinogen and causal effects versus IRIS. I guess I just needed some clarification. Is there something different when we're looking at risk effects, risk assessment that may be non-carcinogenic versus carcinogenic? And is that something you feel we need to address with this particular committee?
Yeah, thanks, Ken. The couple of issues. Of course, IARC just does deal with carcinogens, and IRIS deals with a wide range of carcinogenic and non-carcinogenic outcomes. And as you know, the IRIS process provides certain kinds of risk guidance numbers that differ in their basis for cancer effects and non-cancer effects. Clearly you'll be, as a committee, confronted with both cancer and non-cancer outcomes, and we'll have to think about how you will bring the information together. In some ways, it's perhaps easier for cancer than the host of non-cancer outcomes that may be of interest. I think, IARC, the schema, or what IRIS does or other systems do are useful, I think, in terms of the integration of different lines of evidence, whether you're considering cancer or non-cancer outcomes. So, I think these are all useful models. In the end, perhaps what my quick review shows that expert judgment still remains, the basis for putting the evidence together. I will say, and I think the systematic review that you just heard illustrates the importance of specifying the questions and also having topic-specific expertise in evaluating the evidence, whether it's related to, addiction, pulmonary toxicity, potential cardiac toxicity, reproductive toxicity, or whatever it is. I think that's part of the challenge that that you face.
Okay, great. Thank you.
One more question.
If I can have a question, just to follow, I think it was raised here, and I think we will challenge with this, and I would like to ask you about your advice and how you distinguish the health effects of the device, of the e-cigarettes itself, and the health effects caused by the change of the behavior in terms of quitting. Because, e-cigarettes may lead to quitting, to reduction of the smoking, and then we see improvement in the biomarkers, we see improvement in the health effects, COPD, etc. But it's not e-cigarette that is most likely driven those changes, but is mediator because people quit smoking. So what we see is actually effect of quitting smoking. On the other hand, we might see the studies that looking at just the direct effect of electronic cigarettes on pulmonary function or cell lines, etc. So how did you deal with this in your review on the health effects, how did you separate these two different, mediator effect versus direct effect?
So at this point, we have not divided it in that way. That is a really good point. I think what would answer that question better would be to have a longitudinal study of non-smokers using ENDS to see how that impacts their health over time, which we just don't have at this point.
Yeah, and again, with this review, we had to kind of impose some structure on it, which by necessity had to be kind of broad categories, but questions like yours, I think, could be posed to the data set. So we could, with that specific kind of, those parameters, we could go back, or you could go back and say which of the studies are, the health effects that are, in a sense, mediated or driven by the behavior change versus, health effects that are some, say the secondhand exposure health effects would be a good example where people aren't, they're passively exposed. But so our point was really to just collect as much of the information as possible, to put it into a place where at least we could begin to make some sense of it, and then allow for drilling down and asking more specific questions.
Okay, I have a couple of questions myself too. First, I would like to ask Jonathan Sammet. John? Yes?
Yeah.
So my question is regarding in your figure, in the very nice figure where it shows the need of systematic reviews to integrate the human, the animal, and the mechanistic evidence. So the three arrows, they look the same, so they have kind of the same weight, the three lines of evidence. And then for the IARC, you showed the table with the animal and the human. Then you also mentioned the mechanistic data and some criteria in terms of qualifying the mechanistic data as weak, moderate, or strong, and some guidelines to apply that. Do you, in terms of doing the systematic review and the effort for systematic review, how, in your experience, maybe from the IARC experience, how much importance it is, and how to do the effort in terms of doing the systematic review for the mechanistic data? Do you think it should be, should we do it equal? Should we, just trying to anticipate some of the concerns that, the challenges that we might face?
Right. So, a couple comments, and really good question. So the arrows happen to be of equal weight only because that's the way they were drawn. But clearly in the IRIS process, all lines of, and IARC or any process, all lines of evidence should be considered. I mean, I will say in listening to the presentation by Allison and Ray, there was not a discussion of sort of the broader body of evidence on the compounds, carbonyls or others that we know may be generated by these electronic devices. So if you go read what we wrote about in the review of the IRIS, it's clear that approaches for systematic review of mechanistic data are still evolving. And it's hard to sort of draw the box, in a sense, on some fairly potentially vast literature that you might open up around, particular mechanisms. Let's say you postulate that oxidative injury is important, and then there's immediately a huge and, far too large a literature to be reviewed. I think this is where careful specification of what the questions are to be addressed is really, really critical, so that reviews of the mechanistic literature can be done appropriately. I mean, I think too often, the epidemiological data are looked at, and then perhaps there's a cursory look at the relevant mechanistic data. So I think as you formulate questions, I think you're going to have to be very precise in your specification. And on the mechanistic side, those questions could relate to exposure, maybe just sticking with oxidative stress for a moment. Does electronic cigarette use involve increased exposure to reactive oxygen species? What are the consequences? I mean, I think you would have to formulate those approaches very carefully. IARC does quite large mechanistic reviews. I will say in both volumes 183 and 109, there was quite extensive reviews of methodological work in specific areas, with some of it attempting to be systematic, I think particularly in the air pollution monograph. But it's very hard to it takes work to develop the right search criteria to make such a review feasible.
Thank you. Thank you so much for the insight. And I had one more question, but I think our time is over. So I will ask the question, and then you can provide me the answer. And the same for the members of the public. I am sure some of you might have questions for the speakers, but please give the questions to us, and we'll make sure that we provide the answers to you. So thank you very much to everybody. Thank you to the panelists for the great session.